Now there's different types of tears when it comes to the meniscus, and we actually have a graphic, and you are going to help us break these down, no pun intended, but you're going to help us break these down and show us what each of these tears signify. So what are we looking at, Doc?
So it looks like on the one on the top left is an incomplete tear. I could still see tissue below it without seeing all the way through to the white background, which could be a cleavage tear or incomplete tear to the top. The one in the middle on the top would be a radial or a parrot beak, which means that it goes across the meniscus. And it's important to know that, as we discussed in that first segment, that if you, I'm gonna go to a model here a second, if you tear the meniscus in that radial fashion, straight across, those fibers are basically torn. Like if you have two ropes or a rope in both ends, once you go across it, it's now the rope doesn't work at all.
Right, I mean, so there's no way of putting it back together.
Well, we could fix it, but the meniscus isn't functioning anymore like it used to. But you still have a tear on the, if you go back to the graphic again,
pull up that graphic.
There. If you look at the third one to the right, it's a vertical tear. So if you cut out a part of the meniscus and you come back to my model and just take the inner edge out, you still have the majority of the fibers are intact that still allow the meniscus to function. So that's why there's different severities in the meniscus.
While that's a horrible tear, we saw that third photo, at least it's a little better than the middle one because you didn't break through those fibers.
And it could be much bigger and still be a lot less damaging to the knee.